Hello, my name is Jessica Bateman, and I will be one of your hosts for today's presentation. I am the Director of Federal Programs for the Division of Developmental Disabilities with the Department of Mental Health. The objectives of this presentation are to explain the history of 1915C home and community-based services waivers, review the process for states to request and renew HCBS waiver programs, share proposed waiver program changes that will or could impact you and individuals enrolled in a waiver program through the Division of Developmental Disabilities, and lastly, learn how you can share feedback about these proposed changes. Let's start off discussing the purpose and history of home and community-based services waiver programs. In 1981, the Social Security Act was amended to add a section called 1915C. This section gave states the option to provide specialized services and supports in an individual's home and preferred community rather than in an institutional setting like a hospital, nursing home, or intermediate care facility. These programs are commonly referred to as home and community-based services, referencing the home and community setting where services and supports are provided. You might also hear these programs called 1915C waiver programs, referencing the specific section of the Social Security Act that paved the way for these important programs. And you might also hear these programs referred to as Medicaid waiver programs, referencing how these programs are funded through Medicaid. The Centers for Medicare and Medicaid Services, commonly referred to as CMS, is the federal agency that's responsible for oversight of home and community-based services waiver programs. States are allowed to create and develop waiver programs based on the specific needs of populations, resources available to the state, service delivery systems, and other state goals and objectives, as long as all federal requirements, regulations, and laws are met. CMS requires states to complete an application for 1915C home and community-based waiver for each waiver program the state would like to offer. The application can be thought of as a contract. It's extensive, think 400 plus pages, and must describe in detail how the waiver program will be operated and comply with all federal requirements. States must receive approval from CMS before enrolling eligible individuals into a waiver program. CMS also requires states to renew approved waivers every 5 years. In Missouri, the Department of Social Services MoHealthNet Division is the Medicaid authority. MoHealthNet Division partners with the Division of Developmental Disabilities to operate 4 Medicaid waiver programs, specifically for individuals with intellectual or developmental disabilities. You might receive, know, or support individuals enrolled in waivers through the Division of Developmental Disabilities. These waivers are the Community Support Waiver, Comprehensive Waiver, Missouri Children's with Developmental Disabilities Waiver, previously known as the Sarah Lopez Waiver, and the Partnership for Hope Waiver. The purpose of each of these waivers is to help individuals with intellectual or developmental disabilities who are at risk of long-term institutionalization remain at home or in their preferred community with specialized supports and services. I do want to emphasize that the proposed changes in today's presentation only impact the 4 waiver programs offered through the Division of Developmental Disabilities. Missouri has other home and community-based service programs through the Department of Health and Senior Services. However, the proposed changes discussed in this presentation are only for the waivers offered through the Division of Developmental Disabilities. Missouri must renew 2 waivers operated by the Division of Developmental Disabilities, the Community Support Waiver and the Comprehensive Waiver, with CMS by July 1st, 2026. The renewal process involves states submitting a new application to CMS for review and approval. If states want to include any changes to their application, those changes have to be clearly specified within the application. The Division of Developmental Disabilities has proposed several waiver program changes to include in the next renewal applications. To ensure consistency between all 4 waivers the division administers, application amendments for Missouri Children's with Developmental Disabilities Waiver and the Partnership for Hope Waiver will also be submitted to CMS at the same time. All waiver program changes would be effective July 1st, 2026. However, we want to hear from you first. Your lived experience and feedback about these proposed changes will help the division make recommendations to MoHealthNet before final submission to CMS. The Division of Developmental Disabilities has opened an informal public comment period from February 18th through March 19th to gather your input directly. Later in this presentation, you will learn how to send your public comment straight to the division. After the informal public comment period, the division's responses to stakeholder feedback and considerations will be shared on the division's webpage. I also need to make an important disclaimer. On December 16th, CMS revised their HCBS waiver application template. The updated waiver application has slightly different formatting and will require states to provide additional information about policies, procedures, and operations. The changes that you are about to hear today do not include any of the updates and/or changes that will be required due to the new application version and CMS requirements. Those modifications will be included in the formal public comment period that MoHealthNet will host later this fall. The formal 30-day comment period is hosted by MoHealthNet because that's Missouri's official Medicaid authority. MoHealthNet will publish public notice of the formal public comment period in 5 newspapers across the state and on their webpage. MoHealthNet will also provide notice to Missouri's tribal governments. Feedback submitted as part of the formal public comment will go directly to MoHealthNet, but will be shared with the Division of Developmental Disabilities, and a summary will be provided to CMS. The summary includes the comments received during formal public comment period, reasons why any comments were not adopted, and any modifications to the waiver that were made as a result of the public comment process. But for now, I'd like to introduce an esteemed colleague, Dr. Timothy Weil. He is the Division of Developmental Disabilities Chief Behavior Analyst and will present on changes being proposed to individual safeguards and contracted behavior analyst qualifications.
Hello all. As mentioned, I am Dr. Timothy Weil. I'm the Chief Behavior Analyst for the state of Missouri. I'm speaking to you today in an effort to relay changes that have been made to Appendix C and Appendix G in our new waiver application. This information includes a listing and brief discussion of two categories of procedures. The first pertains to what we call limited procedures that require a due process review. The second category pertains to prohibited practices, or otherwise known as practices that may not be utilized under any condition with individuals on the waiver. We'll start with limited practices. Again, limited practices are some practices that may occur in some situations and require due process before being put into place. The first on our list is enhanced staffing. This refers to the use of one-to-one or higher staffing levels for supervision and/or safety, and is considered a component of the services. The next is environmental restraint. This is a practice that limits a person's access to some aspect of their environment, activities, and/or things in their environment in an effort to manage behavior. The next on our list of limited practices is called medical intervention. This is an intervention utilizing a PRN medication that is prescribed to treat some identified target behaviors associated with a diagnosed medical or psychiatric condition. These are different than chemical restraints, which we'll speak to on the prohibited procedures list. Physical restraints is the next item, and it means manually holding or restraining all or part of an individual's body in a way that restricts the individual's free movement. The next, protective device, refers to equipment that might be used to protect an individual from physical risk or injury. These are things that may be prescribed as part of a medical procedure and/or severe behavioral issues. The final procedure on the limited list refers to timeout, specifically to exclusionary timeout. This means or refers to the temporary exclusion of an individual from accessing reinforcement. This includes an individual who may be separated within space or to another area of the home, but does not include seclusion and does not include being required to remain in a room alone. Again, all limited practices do require the Due Process Review Committee and should be approached before attempting any of these practices. So too, these practices may also require a crisis safety plan and/or a behavior support plan if the behavior requiring the individual is dangerous, putting the individual and/or other persons at immediate threat of significant harm, injury, or death. Again, timeout exclusionary is one of those practices that should be supervised by a behavior analyst and included in a BSP with both skill acquisition and fading plans included. The following list contains practices that are considered prohibited in the state of Missouri. That means that they're not allowed under any circumstances by DD waiver providers. This does include self-directed support employees. So first and foremost, the first prohibited practice pertains to actions that might inhibit an individual's ability to breathe, any compression of the chest, neck, or abdomen, or the hyperextension of joints, as might be seen in physical or mechanical restraining. The next on our list of prohibited practices refers to aversive stimulation or conditioning. And this simply means the application of something that is unpleasant to the individual. These could be smells, these could be loud noises, but whatever the individual is likely to move away from or find aversive. Chemical restraint refers to a drug or medication that is used to control a person's behavior or restrict their movement and is not a standard treatment for their psychiatric or medical condition. So the distinction between chemical restraint and mechanical restraint is that a mechanical restraint is in fact a prescription identified with respect to either a medical condition or a psychiatric condition and can be provided on a PRN basis. Chemical restraints are not prescriptions. They're not permitted to be utilized in home and community-based waivers. The next on our list is corporal punishment. and this refers to the use of physical force to cause pain or discomfort in an effort to control an individual's behavior. On our list next are enclosed cribs, beds, and barred enclosures. It should be noted that the waiver will not provide reimbursement or purchases for enclosed cribs or barred enclosures. In addition, while you have the right to purchase these on your own, it is the case that individuals providing waiver services cannot include interaction with the enclosed crib or barred enclosure, and as such would not be able to utilize this during billable time. The next that we have on our list is mechanical restraint. This refers to any device that's attached to a person's body that they cannot remove, and it restricts freedom of movement or normal access to their body for behavior control. All mechanical restraints are prohibited. Our list continues with overcorrection, and this is a procedure that requires an individual to repeatedly perform a task as a consequence for having done something wrong. Prone and supine restraints are also prohibited. So whereas physical restraints are on the list of limited procedures, and you may approach due process to put these in place, even if approved, you cannot engage in prone or supine restraint. This refers to techniques that involve an individual laying down either face down or face up. Response costs refer to the removal of an individual's personal property or earned items because they've engaged in problematic behavior. In short, response cost is taking something away that the individual owns or has earned. Seclusion and seclusion timeout refers to the involuntary confinement and isolation of an individual alone in a room from which the individual cannot leave. They are also not allowed to have contact with others during the procedure. Seclusion timeout is a prohibited practice. And then finally, utilizing law enforcement as a behavior support plan strategy is prohibited in the state of Missouri. Those pertain to the changes that we've made with regards to Appendix G in order to provide for individuals here in the state of Missouri more transparent and clarity with regards to what might be a limited practice or a prohibited practice. Beyond this, we've made changes in Appendix C as it relates to the practice of applied behavior analysis. The first change was to match state plan qualifications for individuals who are providing services. We've included a provisional licensed behavior analyst situation where individuals who have completed their didactic coursework, but still may have field work or clinical experiences remaining in their education, that they would be able to apply for and acquire a provisional licensure for behavior analyst position as long as they are under the supervision of a fully licensed behavior analyst. We have also changed it to align with the state plan so that behavior analysts from bordering states can provide applied behavior analytic services here in the state of Missouri. Separate from those plan qualifications, we've taken a look at and decided that certification required to practice behavior analysis in the state of Missouri will require a certification as an assistant behavior analyst, certification as a behavior analyst, or certification as a doctoral level behavior analyst. This change indicates that individuals who are not licensed or provisionally licensed in the state of Missouri in applied behavior analysis are not permitted to provide behavior analytic services. And the change includes psychologists, counselors, and social workers, as well as QDDPs. Thank you very much. Look forward to your feedback.
Hello, my name is Wanda Crocker, an Assistant Deputy Director with the Division of Developmental Disabilities, and I will be speaking about the proposed service definition and waiver program assurance changes. We think it's important to explain that the division can currently only contract with one provider for intensive therapeutic residential habilitation, and that provider offers one location under the 1915 B4 Waiver Fee-for-Service Selecting Contract Program. The proposal to allow the 1915 B4 to expire means the division could contract with more than one qualified provider. This change would allow more individuals within the comprehensive waiver to receive this service, expand locations across Missouri, and offer individuals provider of choice and location. The term individualized support plan is specific to Missouri. Individualized support plan is being replaced with the term person-centered service plan. Person-centered service plan is a term recommended and used by the Center for Medicare and Medicaid Services. Changing the term from individual support plan to person-centered service plan is best practice and will make our language consistent with national terminology. During the eligibility determination process, commonly known as intake, the change proposes to accept valid adaptive assessments completed outside of the division. These are often referred to as collateral adaptive assessments and are collected during the intake process. Accepting these assessments means the eligibility determination can be made faster and individuals can gain access to services quicker. A collateral adaptive assessment is considered valid for general division eligibility if it is a standardized, comprehensive, norm reference tool completed within the last 3 years. The tool must evaluate the functional limitations criteria defined by the Code of State Regulation. An example of an acceptable collateral adaptive assessment is a Vineland. The Missouri Adaptive Ability Scale, otherwise known as the MAS, is required for general division eligibility in situations where the applicant does not have a valid adaptive assessment or the collateral adaptive assessment does not show the required functional limitations for the individual's current age. The MAS continues to be required for all waiver eligibility verifications. In August of 2013, the support coordinator signature line was removed from the waiver choice form. Therefore, support coordinators are no longer required to sign the form. This proposed change is to align the waiver language to reflect the current process. The division proposes to remove the annual limit of 40 hours of technology support. Removing this limit supports individuals to access additional support from their device and/or technology provider. The goal of this proposal is to help individuals increase their comfort and confidence with the technology, leading to continued and increased usage of technology supports. It's important to remember that while the limit will be lifted, the amount of the technology support continues to contribute to the assistive technology waiver cap. Another proposed change is to remove the language around preventing institutionalization from the Environmental Accessibility Adaptation Service definition. You might commonly reference environmental adaptation accessibility, as otherwise known as EAA. You might commonly know this as a home or vehicle modification. In order to meet the home and community-based waiver eligibility, an individual has to meet a certain level of care and be at risk for institutionalization without waivered services and supports. Because this is an overall home and community-based service waiver requirement and not a requirement of any specific service, the division proposes to remove that wording from the EAA service definition. The division also proposes to make a change to the EAA service definition that reflects that an individual who has more than one legally responsible person that lives in different households can, let me give you an example. A person who lives, who has divorced parents and they spend equal time in each parent's home. To ensure that we can serve both homes and or vehicles, we would like to allow EAA authorizations to more than one home or vehicle in Missouri when an individual spends equal time with both legally responsible persons. For example, Sue spends 50% of her time with her mother and 50% of her time with her father in different homes. Sue utilizes a wheelchair for mobility, and both of her parents need a vehicle that can support her needs. This change will support each parent to modify a vehicle they own to provide the support Sue needs while she is with them. Modifications made to more than one home and vehicle contribute to the overall EAA service waiver cap of $20,000 across 2 years. The division's specialized medical equipment limit is currently $7,500 per person-centered service plan year. However, if the individual's needs cannot be met within that $7,500 limit, and all other funding sources have been explored and exhausted, an exception may be approved. At this time, there is no exception limit. The division proposes setting the exception limit at $10,000. At this time, no individual authorizations exceed $10,000. Therefore, the health and welfare of individuals will not be impacted. These next two items we're going to talk about are from Appendix C, which describes the specific performance measures the division reports to the Center for Medicare and Medicaid Services. Individuals receiving services are not impacted by these changes, which speak to the sample size used when reviewing provider personnel records for required qualifications and training. The Provider Relations Site Review process collects performance measure data regarding all personnel who deliver services requiring certification or accreditation. These services are individual supported living, group home, day habilitation, individualized skills development, community networking, employment, and shared living, both host and companion. We also collect performance data around non-certified, non-accredited services, which are personal assistance and respite. There are two performance measures that report on the direct support professional information gathered during the provider site review. One on waiver qualifications, which is background screen and education requirements of direct support professionals, and one on training, such as abuse and neglect, first aid, CPR, medication administration, positive behavior supports, and person-centered support plan training. To ensure the data is a representative sample of all personnel delivering the waivered services, the division proposes to set the minimum sample size of 400. This next proposal for change speaks to a subset of direct support professional service, and it specifically pulls out the data relevant to personal assistant and/or respite direct support professionals. The measurement is the number of direct support professionals delivering PA or personal assistant and respite that meet all waiver training requirements, such as abuse and neglect, first aid, CPR, medication administration, positive behavior supports, and person-centered support plan training. This information is also gathered during the provider site review. To ensure that the sample size remains representative as the program grows, because there's a different number of staff each year, the division proposes that the universal sample for each year be determined by adding 200 to the previous year's universal sample. And Jess, with that, I will turn it back over to you.
Thank you to both Dr. Weil and Wanda for sharing the proposed waiver program changes. As a reminder, these changes will have a direct impact on you and those receiving waiver services from the Division of Developmental Disabilities. The division is requesting stakeholder feedback during a 30-day informal public comment period starting on February 18th through March 19th. Your feedback and lived experience is important to us. Please visit the division's federal programs webpage. The following content will be available through March 19th. A recording of this presentation, a chart outlining the proposed waiver changes, another chart that outlines waiver application updates. These updates are not expected to have an impact on any waiver program, policies, or operations. These updates are mainly terminology changes or other technical revisions. You'll also find a copy of corresponding waiver sections, which CMS calls an appendix, with all revisions. And lastly, a new online form to submit your feedback and informal public comment to the Division of Developmental Disabilities. Of Developmental Disabilities, thank you for all your feedback and partnering with us to serve, empower, and support Missourians to live their best lives. If you have questions about information covered during this presentation or need assistance submitting online feedback, please send an email to ddmail@dm.mo.gov with informal public comment in the subject line. You may also call our division's main line at 573-751-4054. Thank you.